Hello, students. Good morning to all of you. In this lecture, we will study the Indian public health standards. So, before moving to actual topic, let us see what is standard. So, standard means a level of quality, especially one that people think is acceptable. The Indian public health standards, the IPHS, they are a set of uniform standards envisaged to improve the quality of healthcare delivery in the country. They were developed by the Ministry of Health and Family Welfare, Government of India, under National Rural Health Mission. The first version of these standards came in 2007. Later, these standards were revised in 2010, then 2012, and finally 2022. The latest version is 2022. So we have Indian Public Health Standards guidelines for district hospitals, for sub-district hospitals, for primary health centers, and for sub health centers. So, in this lecture, we will focus on the sub health centers. In Indian Public Health Standards 2022 guidelines, the sub health centers they are classified into two categories. One is the health and wellness center, sub health center in rural area, and other is urban health and wellness center in urban area. So these centers are most peripheral, grassroots level, first level of contact between the primary healthcare system and the community. And they are involved in providing all the comprehensive primary healthcare services to the people. So, as per Indian Public Health Standard, all health and wellness centers should have a national identification number and register on the Ayushman Bharat Health and Wellness Center portal. A citizen charter should be prominently displayed near the entrance of the health facility. The following healthcare services should be provided at these centers: health promotion, early identification, ensuring treatment adherence, follow up care, ensuring continuity of care through appropriate referral, optimum home and community follow up, disease surveillance. Now, the services packages under comprehensive primary health care. These services should be available at the sub health center level. The first service is care in pregnancy and childbirth, neonatal and infant health care services, childhood and adolescent healthcare services, family planning, contraceptive services, and other reproductive healthcare services, management of communicable diseases, national health programs, outpatient care for acute simple illness and minor ailment, screening, prevention, control, and management of non communicable diseases, care for common ophthalmic and ENT problems, basic oral health care, elderly and palliative health care services, emergency medical services including burns and trauma, screening and basic management of mental health ailments. So these are the 12 packages of services under comprehensive primary health care that should be available at a sub health center level. In addition to these services, these sub health centers, they act as a platform for teleconsultation. Now, the population norms for health and wellness centers are sub health centers and urban health and wellness centers. So, in rural area, we have sub health centers. There should be one sub health centers for every 5,000 population in plain area and one sub health centers for every 3,000 population in hilly, desert, and tribal area. In urban area, we have urban health and wellness center. There should be one urban health and wellness center for every 15,000 to 20,000 population. And these urban health and wellness center, they are supposed to cover the predominantly poor population, vulnerable people that are residing in slums or other such pockets. Now, the manpower requirement at these centers, at health and wellness center, sub health centers in rural area, there should be a community health officer, a multi-purpose health worker male, and one multi-purpose health worker female. For sanitation and security purposes, these health centers can engage some part-time workers based on their need or state policy. Manpower at urban health and wellness center in urban area are one medical officer. There should be one staff nurse or pharmacist, one multi-purpose health worker male, and one support staff. So we studied what is the population norms, manpower requirement, and the services packages under comprehensive primary health care. So this was all about the Indian public health standard at sub health center level. You can study this topic in detail from the guidelines, Indian Public Health Standards 2022 guidelines for sub health center, where you can study in detail the services that should be provided at the sub health centers, and in addition, infrastructure requirement at sub health center level, then the process of monitoring and supervision and other relevant things. But for an undergraduate, this lecture is sufficient uh, at this level. Thank you. Have a nice time.